brothers and sisters, for my fellow Muslims, let us raise our hands for prayers, and for the non-Muslims, you may also pray according to your respective beliefs. We begin our prayer with the Kitab Al-Fatiha. Bismillahirrahmanirrahim. آمين آمين يا رب العالمين. بسم الله الرحمن الرحيم. الحمد لله رب العالمين والصلاة والسلام على أشرف الأنبياء والمرسلين وعلى آله وأصحابه أجمعين. اللهم إنا خلاق العظيم إنك سميع عليم إنك غفور رحيم إنك رب العرش العظيم إنك البر الجواد الكريم. O Allah, our dear God, on this auspicious occasion in celebration of the charity program, we are aware because we care. We, as your humble servants, dear Allah, beg for your everlasting grace. Bestow upon us your guidance in seeking your blessings. O Allah, please shelter us from all harm's way, forgive our sins, strengthen the unity and the camaraderie of our multiracial society. Ya Rahman, Ya Rahim, instill in us noble dispositions so we may practice quality work ethics and so we may continuously strive for improvements in our daily lives for the sake of organizational, societal, religious, and national advancement. O Allah, imbue within us a sense of responsibility for all the tasks entrusted upon us to be fulfilled. Ya Dal Jalali wal Ikram, bless us with the grace of mental and physical health, tranquility, and the strength of spirit. May with it we shall be capable of facing challenges, uplift the honor of our family, society, religion, and the nation. اللهم اجعل جمعنا هذا جمعا مرحوما وتفرقنا من بعده تفرقا معصوما ولا تجعل اللهم فينا ولا معنا ولا من يتبعنا شقيا ولا مطرودا ولا محروما اللهم اجعل خير أعمالنا آخره وخير أعمالنا خواتمه وخير أيامنا يوم ألقاك فيه اللهم اغفر لنا ذنوبنا ولإخواننا الذين سبقونا بالإيمان ولا تجعل في قلوبنا غلا للذين آمنوا ربنا إنك رؤوف رحيم ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار وصلى الله على سيدنا محمد وعلى آله وصحبه وسلم والحمد لله رب العالمين.
Amin Amin Ya Rabbal Alamin. Thank you, Muhammad Luqman, for the recitation of Dua just now. Without further ado, I would like to welcome Ms. Nur Amira binti Abdul Rahman, the Program Director of Charity Program, to deliver her speech. Ms. Amira, you are currently on mute.
Test, can you hear?
Yes, we can hear you clearly.
Okay, sorry doktor tadi. Okay. Mama Mas Muhammad, okay. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning and greetings to Dr. Nur Ashikin binti Mahmud, Psychology Interactive Club Advisor, Psychic. Our Honorable Guest Speaker, Dr. Sharini Bazir Ahmad, the President of Malaysian Society of Epilepsy, fellow UTM students and all committee members of Psychic Charity Program 2022. Alhamdulillah, praise to Allah Subhanahu Wa Taala, we are provided with the golden opportunity today to be here this evening for our charity program session 2021 and 2022. For your information, this program is organized with the purpose to increase awareness about epilepsy among students by understanding the daily struggle of epilepsy patients and to enhance students' feeling of empathy towards the patients, conditions and problems. Not only that, this program also wants to increase and obtain information regarding epilepsy and break the stigma regarding epilepsy. And lastly, to prepare the skills and activities in treating epilepsy patients with the proper treatment and action. First of all, I like to give my biggest thanks to the guest speakers for their willingness to spend time and share useful knowledge with us. It is such an honor to have you with us. Not forget to mention all the participants who attend and ensure the success of this program. Without your presence, this program won't be able to achieve its objectives. I will also like to thank Psychology Interactive Club Psychic for giving me the opportunity to handle this program. Million of thanks to my fellow teams member for their hard work and commitment, turning each of our plans into reality and making sure everything goes smoothly. Of course, I also like to thank all the people who contribute to this program's success, either directly or indirectly. Without your efforts, this program could not be successful implemented. It is undeniable that within every program there could be shortcomings, defects, and obstacles along the way. Therefore, as the director and speaking on behalf of the committee members, I would like to apologize for any shortcomings. May we all learn from it and improve for the better. I sincerely hope that all the committees and participants will gain benefits from today's program and may share knowledge become a useful guide for us in the future. Finally, I hope that from this charity program, students are able to greatly improve their knowledge about epilepsy and can provide help to the people who have this epilepsy. That's all from me. Thank you.
Thank you, Ms. Nur Amira, for your lovely speech. Moving on, I welcome Dr. Nur Ashikin binti Mahmud, the Psychology Interactive Club advisor, to give an opening speech and officiation ceremony.
Thank you very much, Yan. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi taala wabarakatuh. Salam yuti and sanjungan bangsa. Greetings to Nur Aisyah Nadra as the Psychology Interactive Club President, Nur Amira binti Abdul Rahman, our honorable guest speaker for tonight, Dr. Sharini Ahmad. Thank you very much, for willingness to be part of our program tonight, the Leadership Board of Charity Program, committee members and beloved participants. Ladies and gentlemen, Alhamdulillah, we are grateful to Allah Subhanahu Wa Taala with His bounty and permission that we can be together tonight, for this charity program today. So first of all, I would like to congratulate the organizers. I will always say kudos to Psychology Interactive Club Psychic and all parties involved, either directly or indirectly, for the efforts and commitment given to make this program a success. This is a charity program, so it is the first time ever that it has been organized, and the target is not only psychic members, meaning that the psychology students and UKM students, and also for the public, and also for other psychology students in Malaysia and also all over the world. So the slogan is "We care, we aware because we care," and this tonight is targeting on the epilepsy. So I would say it's a very interesting topic. Normally that we heard about it, but we have no idea what is it actually. So by knowing the word itself is not sufficient. So by tonight, we are able to know what is it epilepsy, and we are very fortunate that we can hear it from the expert. And I would like to, call upon my students to really pay attention and call your friends, like message your friend, ask them to join. It's not too late yet, and announce it to everyone, like, hey, we have a very wonderful programs tonight that everyone can learn about epilepsy, and we get it from the experts actually, and it's not like some things come by easily actually. So our director have mentioned just now about the objectives of the programs, and I'm not going to repeat it again. And pretty much you get the awareness, you get the knowledge, and you know what it is actually. So there's always a saying in English that the more you know about it, the more you fall in love with it, the more you you can feel it actually. Yes, that's what this program is all about. So once again, I will not extend the time. I congratulate the organizer and participants for having successfully implemented this program. Hopefully the knowledge gain can benefit yourself and others. Therefore, with gratitude to Allah, I am pleased to officiate the charity program. Thank you very much. Wabillahi taufiq wa hidayah. Assalamualaikum warahmatullahi ta'ala wabarakatuh.
Waalaikumsalam. Thank you to Dr. Noor Ashikin binti Mahmud, the Psychology Interactive Club Advisor, for the
Yay.
opening speech and officiation. Ladies and gentlemen, before we get started, I would like to provide a little introduction about our guest speaker for today's program. Dr. Sherini Bazir Ahmad is currently the president of Malaysian Society of Epilepsy at University of Malaya Medical Center, Kuala Lumpur. She also has been designated as consultant physician and neurologist at Subang Jaya Medical Center. A part of being that, she has graduated from clinical school as consultant neurologist and general physician and has specialty in neurology. In addition, Dr. Sharni Wazir Ahmad has wide knowledge in treating patients with epilepsy or epilepsy surgery, general neurological diseases, headache, Parkinson's diseases and other movement disorders, and stroke. I could go on with this great list of accomplishments, but let us not waste any more time and meet our wonderful speaker. But before that, I would like to remind the participants, if you have any questions to be asked to the speaker, you are all welcome to write your question in the chat box. And you may also use the raise hand function if you want to ask your questions verbally. With that, I welcome Dr. Sharni Bazir Ahmad to deliver her speech on the topic, how to handle epilepsy patients, especially for the first time.
Thank you very much for the kind introduction. For your information, I'm no longer working regularly in University Malaya. So I'm now actually based in Subang Jaya Medical Center. And first of all, I would like to thank all of you, especially the organizer, the psychic, for organizing such a wonderful event like this. I have to say at 8:30 at night on a weekday, I think a lot of you would rather want to be, in your room, relax, watch Netflix, or prepare for your next class tomorrow. But hey, you all are here. And because you all are here, I want to be here as well because we want to learn about epilepsy. Thank you, President of Psychic, Nur Amira, Dr. Norashikin, and everyone involved in organizing this today. I feel very, very delighted to be here and happy to be here to join all of you. So without further ado, I would like to, on behalf of PEM, speak a little bit about epilepsy tonight. And I was told that there will be a quiz after the talk, right? Okay, so you have to listen, otherwise you can't answer the quiz, okay? So let me start with sharing my slide. Okay, so you can see my slide, all right? Yep.
So we can see it clearly.
Okay, all right. Let's start with the topic for tonight, which is all you need to know about epilepsy. Now, okay. First of all, the first question when you come to talk like this is, what is epilepsy? I think maybe most of you probably have Googled it before coming to this talk today. Hence, some of you already know what is epilepsy. But do you know actually the word epilepsy originally comes from a Greek verb, epilambanian. What does it mean? It means to be seized or to seize upon, or to be overwhelmed by surprise or to possess. So I try, I have a version of bahasa as well in the slides, i.e. ditangkap, dikuasai, dirampas, diserang dengan secara tiba-tiba atau dirasuk. But that's the old definition of epilepsy. What is actually epilepsy? So epilepsy is when someone has a seizure which resulted from a sudden abnormal electrical activity in the brain. So cetusan gelombang elektrik yang tidak normal di dalam otak secara mendadak. So in bahasa we call it a serangan seizure ataupun sawan. Now you'll get a bit mixed up with what is epilepsy, what is seizure, can we use the words interchangeably? Well, there's a difference between epilepsy and seizure. Okay, so epilepsy happens if patient have two or more unprovoked seizure, i.e. if someone has two or more unprovoked sawan, okay? Or the patient has something in the brain that put him or her at a high risk of having another seizure attack. So jika kita ada risiko untuk mendapat sawan berkali-kali, so you can have recurrent seizures, then you are said to have epilepsy. If you only have one seizure and there's no risk of you getting another seizure, then you don't call someone has epilepsy. So you have to use the term carefully. So what is seizure? Okay, so seizure is an abnormal electrical activity of the brain that causes the neurons or the brain cells to overfire, causing seizure or epileptic attacks. So our brain is full of electrical activities, and that's how our nerves interact with our body, is through electrical discharges. So when one part of the brain is not really following the rule or start to have or firing on its own, then you may start to have seizure activity. There are many names. Sorry, I'm having a bit of difficulty going to the next slide. There are many names that has been used for seizure. So dalam bahasa Melayu, we call it sawan, tarik, kancing gigi. In English, seizure, fits. In Mandarin, fatwa, valipu in Tamil. So there are many terms that has been used. So what causes epilepsy? So what causes someone to have seizure over and over again, or have the risk of having another seizure over and over again? So in the olden days, and I'm not surprised if some people in the current days also think that epilepsy or seizure is caused by spiritual beliefs of evil spirits. So people in the past believe that people with epilepsy, when they have the seizure attacks, is because they've been possessed. So in the gospel, according to Saint Mark, Jesus Christ cast out a devil from a young man with epilepsy. This is a drawing to show that Jesus Christ is trying to cast out devil, okay, performing a spiritual act to get the devil out from this man. And it says here that in the gospel, "Teacher, I brought you my son who is possessed by a spirit that has robbed his of speech, so unable to speak. Whenever it sees him, it throws him to the ground. He foams at the mouth, gnashes his teeth, and becomes rigid. I asked your disciples to drive the spirit out, but they could not." So that's what in the olden days people believed the cause for epilepsy, which is clearly not true. So fact number one, epilepsy is not caused by evil spirit. So what causes epilepsy? And that's why you are here today. So epilepsy is caused by abnormal electrical activity in the brain. So anything that upset the brain or scars the brain. So kalau ada kesan-kesan scarring of the brain, that can cause people to have epilepsy. For example, if someone has infection of the brain, meningitis or encephalitis, basically means infection in the brain. This is just a fancy name saying there's an infection in the brain. Sama ada from bacteria, virus, fungal, tuberculosis, doesn't matter. Brain injury, so trauma to the brain that cause scarring to the brain can cause someone to have recurrent seizures or epilepsy. Stroke, when there's abnormal circulation in the brain, or blockage of circulation in the brain, or bleeding in the brain, tumor or brain cancer. Epilepsy can also happen during childbirth, in which baby was born with less oxygen, whether to do with the problem during delivery or during when the baby was still in the womb, or if there's any injury to the baby after delivery. Abnormal developmental structure of the brain. So while we're growing up, the brain continues to develop. So if there is any abnormal developmental structure of the brain that can cause seizure, there's certain type of syndrome or genetic factor, and also immune, in which our body produce a certain type of antibodies that attack the brain, and this can cause inflammation to the brain and cause epilepsy. So looking at the epilepsy causes, so this is a fancy pictures of your brain. So these brain scans are from MRI of the brain. MRI is a magnetic resonant image of the brain. So a special machine that we use to take photos of our brain in different slices, in very, very thin slices. Okay. And when we look at epilepsy causes, when I say brain tumor, so that if you look at the photo over here on the left side, there's a tumor, big tumor sitting in the right side of the brain, and this can cause epilepsy or seizure. The picture in the middle, normal brain should look grayish, like where my arrow is at the moment, but you see the yellow arrow, this area are abnormal areas of the brain because they're whitish, or lighter grayish, and this is because of a viral infection in the brain called herpes simplex encephalitis. So infection of this brain can cause seizures. The last picture over the far right is bleeding. So normal brain looks like this gray area here over the where my arrow is. And if you look at this big mass here, this is the lighter gray, these are all blood. So this is actually blood clot in the brain. So all this can cause someone to have seizure. And I've mentioned as well, in babies, they can have injury to the brain, whether during the time the baby is in the womb of the mother, during delivery, or during post-delivery insult to the brain. For example, this is a brain of a baby or of a child. On the further left, you could, like I said, the cauliflower shape, grayish, that's your normal brain. But over here, there's a big hollow black, where there's no brain in this region because of this baby has sustained a stroke when baby was born. So the brain failed to develop in this region. And then these are all the other sick looking brain, because the one in the middle, because of low sugar in a baby when the baby was born. And then the further right is due to non-accidental injuries, or what we call like a shaken baby syndrome. So case yang macam penderaan, all those things, yeah, can cause or damage to the brain. Abnormal structure to the brain. So this is what I see most as an adult neurologist. So we look at this is again on the further left, a normal looking brain, but there's a abnormal developmental change in the brain, what we call focal cortical dysplasia. This brain just doesn't look like normal brain. It just the cauliflower doesn't have a lot of what do you call grooves in this brain. And then over here is when on the right side, there is shrinking of one part of the brain, what we call a mesotemporal sclerosis. So all this has a special type of epilepsy that they can get, or special type of seizure that they can get. So who gets epilepsy? Anyone. Certain types of epilepsy can occur in the young patients or babies. Some types are seen in older patients. Some may persist throughout their lifetime. Some may stop once the child has grown up. So there are many different presentations of epilepsy, and it can affect anyone, you or me. So about 70% of epilepsy can be well controlled with medication alone. There's no age, racial, national, or geographical boundaries. It can cause profound physical, psychological, and social consequences. There's a high risk of comorbidity and premature mortality if seizures are poorly controlled. So it is important that epilepsy patients get treated properly. Otherwise, they can die from epilepsy. They can die from sudden death in epilepsy. They can also sustain multiple health complications from having seizure itself. So what happens when someone has a seizure? So the sign and symptoms of a seizure, there are various, the commonest one that you are probably well aware of is the kancing gigi, tarik, the stiffening of the limbs, the stiffening, jerking, tongue biting, that kind of thing. But some patients with epilepsy, when they're having a seizure, they may just appear confused during that particular period of time. Some of them may have like a warning, like they know when they're having an attack. Sometimes they find it very difficult to explain to others what are these feelings. Some people would just suddenly fall, and then that's it. Few seconds they've fallen, and then they just had a seizure. Some may have prolonged fall, and then they become unconscious and start having jerking movement of the limbs. Some may just look blankly at you, and when you talk to them, they just don't respond back, and give them a few minutes, and suddenly they just snap back into reality. And some of them may have just uncontrollable, quick jerking movements of their limbs. They may hold a cup and suddenly the cup's just spilled, Some may have strange sensations, strange emotions. Some patients, before their epilepsy attack, 1 week prior to that, their mood become labile, they become temperamental, they cry for no reason, and some of them may lose consciousness or awareness. So there are many phases of epilepsy. Now, in general, even though there are many different kinds of epilepsy, we generally divide them, to make it easy to the public, is into two types, which is generalized epilepsy and focal epilepsy. So generalized epilepsy is when all the brain is affected at once at the beginning of the seizure onset and the patient become unconscious. Focal epilepsy is when the seizure occur or the abnormal electrical activity occur at one area of the brain that is affected, and it may stay in just that area, and patient may have symptoms relevant to the area controlled by that part of the brain, or it may spread to involve the whole part of the brain, what we call focal epilepsy with secondary generalized. So the person may have impaired consciousness or may be fully aware during this type of seizure. So how common are these seizures? Well, 60%, so the commonest cause of epilepsy is the focal seizures. 30% is generalized seizure, but even with the current technology, current advance in investigation techniques, there are about 10% of patients with seizure. We are not too sure about the onset, whether it's generalized or focal, whether it's combination of both. So in general, there are two types of epilepsy when we talk about focal and generalized epilepsy. Now, when someone has focal epilepsy, it depends on which part of the brain that is affected. So generally, when we can learn a little bit about brain tonight, right? So whoever interested to know a bit more about brain and nerves. So in our brain, we divide them into 4 components, which is the frontal lobe, parietal lobe, occipital lobe, and temporal lobe. Why do we divide them? Because we divide them by function. Now, it depends on where the abnormal discharges occur. So, for example, if the patient have focal epilepsy originating from the temporal lobe, they may have a chewing sensation, they may have what we call oral automatism. During the seizure, they may just stop what they're doing. They may keep chewing, and you're wondering, what are they chewing? Nothing is in their mouth. Or they keep having repetitive swallowing, and they just stare blankly, and they keep swallow and look very confused. They may smack their lips, or they may start fumbling with their hands, and they just appear very confused to you. Sometimes they may have a funny sensation of fear, panic, heart beating very fast, abnormal smell, abnormal hearing, abnormal sensations. If it happens in the back of the brain, which is the occipital lobe, they may have abnormal vision, they may see things that's not there. So, and the other part of the brain, for example, the temporal and the frontal, they may not be able to speak. And some of them may lose awareness. Some of them may have abnormal motor movement in which they may be aware, they may be talking to you, but then their hand is sort of jerking repetitively without them able to control it. So that's a focal motor seizure. They're still aware. I'm going to share you a video of a seizure. So let's look at the video on the left side. This is this girl, she's been admitted to the video EEG monitoring center. So they admit the patient, they put some wires on the scalp, they look at the brain waves. At the same time, they want patient to have a seizure so that they can study where the seizure comes from, and they want to see the pattern of the seizure. This will help neurologists to determine which part of the brain that the seizure comes from. Okay, so she's sleeping. She woke up. She appeared a bit confused. Before that, can you actually see my video? All right. Video okay?
Yes, the video is very clear.
Okay. So she woke up. She looked very confused. Look around. A bit of rocking movement of the trunk. This hand, right hand, look a bit abnormal posturing. She's not able to speak. She's just making sound. And that's just the nurse coming in, checking her wires and all that. And then she goes back to sleep. So some people may think she just had a nightmare or maybe a bad dream. But in actual fact, she was actually having a seizure. And this happened repetitively almost every night. So this is actually a type of seizure that happens, a focal seizure. Okay. So this rocking movement and all that is a very typical type of a seizure as well. All right. Now this lady here over the right side, she's actually having a phone conversation or video call conversation with a relative, and in the middle of the conversation, she stopped, and this happened.
And the white.
So that's the lip smacking or tongue clicking. She stopped talking, not able to speak, appear quite confused. And that's it. So that's actually a type of a focal seizure. She lose awareness. She had some automatism, which I've explained to you much earlier on.
White.
Okay, and this patient, the seizure happened in the temporal lobe, and the one on the left is from the frontal lobe. So it's a focal type of seizure. Now this baby just playing with the tissue and suddenly stopped, staring into space. The hand just went like repetitively, and then the patient and the baby snapped back to normal again. So let's look at that again. Blank. And the right hand was still moving. And then snapped back into normal again. So that was actually a very brief seizure or absent seizure. And this girl looked quite sick actually, but this is just the cable or wires that we put on the scalp to look at electrical wave of the brain. And if you look at this right hand, although the baby is the girl is in deep sleep, but this right hand kept jerking away, soft repetitive jerking. So this is actually a focal motor seizure. So this is different from the usual seizure that you normally see. And this is a drawing of patients who have occipital seizure or focal seizure. And during the seizure, they actually see colorful things and they can actually draw for you what are these colorful things that they are seeing. So in actual fact, this patient is having seizure, but they didn't have automatism. They didn't have jerking. They are still talking to you, but their vision is all changed with these colorful images. Now, in generalized epilepsy, slightly different. This is the more dramatic epilepsy that we see, where you see the patient become unconscious. They have stiffening and jerking of the limbs. So this is the typical one that you probably see in videos or TV, the patient's having stiffening of both arms and legs, stiffened, the face are all stiffen up, and then there's jerking of the arms and legs. So these are the generalized epilepsy. This is a more severe form of the epilepsy. Even patients with focal seizure can actually evolve into secondary generalized. And this lady here, again in a video monitoring center, so she's just sitting there. Ignore the EEG that you're seeing on the right side, just look at the video. She had this sudden brief jerking and it stopped, jerk, 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 and suddenly it goes into generalized upper limbs and lower limbs tonic-clonic seizure. So these little tiny jerks that she's having, what we call myoclonic jerks, this is also a type of epilepsy. So it's very debilitating disease if you get the attacks. And in between, patient is completely fine. And this girl, she's actually blowing into this fan because we want them to hyperventilate. So it's hard to tell children to hyperventilate. The easiest way is to tell them to blow into the fan. She's keep blowing, 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 and then suddenly she stopped. Eyes looking up. Looks like she's in a trance state for a few seconds, and then she's back. A bit of coughing, and she's back. So this is also a type of generalized epilepsy or absence. And children, when they have this in the class, the teachers or friends may mistaken them for having like a daydreaming episodes, you know. So the teacher may say, you keep daydreaming, you're not catching up in class. They can have multiple times. They can have 20, 30 attacks a day in the classroom, and hence they cannot keep up in the classroom. And teacher may thought that they're daydreaming, but in actual fact, they're actually having a seizure attack. So how do we diagnose epilepsy? Well, you can see a neurologist. So I'm a neurologist. There are many other neurologists in this country. And what neurologists do is that we look after brain and nerves. So neurologists will talk to patients and examine patients. So the best part, the best way of diagnosing epilepsy is through history taking. And these days, because of the technology of smartphones and all that, people capture videos. So with this, the story that we get from patients and witnesses, and also combined with the videos that they show us, it makes diagnosis of epilepsy or seizure become much, much more easier. So after we've seen patients, then we will arrange for some tests to help making the diagnosis and choose the right treatment. So you've seen some of these videos, they all have these wires that was stuck to their scalp, okay? So this is called an EEG or electroencephalograph. What does it do? So when you put this wire on, all we see as neurologists are these squiggly lines. And the first time when I saw these squiggly lines, the first thing that came to my mind was, looks like a moving worm, right? Well, this is actually your brain waves. This is how your brain waves look like. So we look at brain waves and we try to differentiate normal from abnormal brain waves. And that's why we do an EEG, because we want to see any focal abnormal electrical activity in the brain. And how do we take images or pictures of your brain? So I've spoken about MRI, which is a magnetic resonance imaging of the brain. And what this MRI does is it takes slices of your photos of your brain so that we can look at the brain structure in a more detailed manner. So can epilepsy be treated? Well, yeah, because you can ask the bomo or shaman or priest or ustad to come and join us and treat the patients. Do you agree? Well, I hope most of you will type in the chat box as no, because epilepsy is not cured with religious or spiritual acts. As I've mentioned earlier, epilepsy or seizure is not caused by evil spirits. Okay? So epilepsy can be treated. In fact, more than 70% of people with epilepsy can lead a normal lives and can be treated with medication alone. There are various medications that can be used, but they have to take this medication on a daily basis. Okay, each of them carry their side effects and all that, which is something that epilepsy patients will discuss with their neurologist. these days as well, surgery can be done. So brain surgery can be done to remove the culprit that is causing the seizure. And we can also use neuromodulation, in which they can implant nerves into the brain, or a wire implant. They can implant wires into the brain, or they can implant some wires around the nerves in the neck, what we call vagus nerve or vagus nerve stimulator and deep brain stimulation, in which this little device here can continuously stimulate your brain in a certain manner to reduce the frequency of the seizure. So there are actually many other ways to treat epilepsy apart from just medication alone. And the treatment goals in epilepsy, whatever we do as neurologists, we have to always balance the side effects of medications and the number of seizures the patient have. At the end of the day, we want our patients to have good quality of life. So we want to help people with epilepsy to lead full and productive life, eliminate seizures without producing any side effects. Okay, so that's the aim of treating any patients with epilepsy. What can you do if someone has a seizure? So this is something that you want to learn. If we have time at the end, I have a video that I can share, but for now, just a slide. When someone have a seizure in front of you and you've seen all that's happened, the video that I've shown you, do not panic. Turn the patient on their side and start timing the seizure. Time is very important. And stay with the person. Do not restrain the person. If the arm is moving that way and this way and all those things, don't restrain, let it happen. What you need to do is you have to protect the head. So you have to place something soft under the head of someone having a seizure. So kalau the person actually fall to the ground, first thing you have to make sure, turn the patient to the side, make sure your surrounding is safe. Turn the patient to the side, put something soft under the head. Do not put anything in the mouth, and call emergency number if the seizure lasts longer than 5 minutes. And we also have a leaflet which Persatuan Epilepsi Malaysia has a seizure first aid leaflet that you can print out from our website, and it tells you exactly what to do if someone has a seizure. And we've seen this drama before. I think it went viral at some point. And this is when a patient was supposedly having a seizure, and the doctor, very young, pretty doctor, came in, and what she did was put a spoon inside the patient's mouth who's having a seizure. But okay, that's not something that you should be doing. Nothing to put in the mouth. Patient may bit the tongue, but biting the tongue, yes, worst thing that happened. I've seen, bleeding from the tongue. They've injured the tongue. Tongue had to be stitched and all those things. But if you put something that blocks the airway, you can cause permanent damage to the brain, and you can't reverse that. So that's may cause more serious damage to patient. So epilepsy facts. Now, we've talked so much about what is seizure, what is epilepsy, and what causes them, how do we diagnose, how do we treat, and how do we help people who are having a seizure. Now, we'll learn a bit more about some epilepsy facts and try to see if there's any myth that needs to be debunked. So epilepsy can cause misunderstanding, fear, secrecy, stigmatization, and social isolation. Do you know that epilepsy is one of the highly stigmatized disease? It causes a lot of misconceptions and prejudice that leads to rejection and isolation, i.e. discrimination. It causes heavy burden to individual, family, and society. And a lot of time, I have to refer my cases to psychologists because they've gone through so much mental challenge, physical challenge to live with epilepsy. And sometimes medication is not the answer to everything. So sometimes they just need someone to talk to. And a lot of time, I do need help from psychologists to help me co-manage my patients. So it is a hidden disability with a hidden stigma. Because epilepsy patient in between attacks, they may look perfectly fine, but when they're having the seizure, it can cause a lot of misunderstanding among people who witness it. So what is stigma? Okay, so stigma, so I think in psychology, you all learn about stigma, right? From the term stigma was coined by Irving Goffman. And what it means is extreme disapproval of a person or group on socially characteristic grounds that are perceived and serve to distinguish them from other members of society. It is affixed to a person by the greater society who differs from their cultural norm. And the perception and judgment varies from one society to another. So, apakah stigma? Ialah perasaan tak puas hati dan tak suka terhadap individu tertentu berdasarkan ciri-ciri yang mendapat tanggapan buruk masyarakat. And siapa yang tetapkan stigma ni? Siapa yang tetapkan certain standard to society? It's the society itself. So we started the certain standard, and whoever doesn't fall into that standard, we look at them differently. So stigma dilihat sebagai penolakan sosial untuk ciri atau kepercayaan yang bertentangan dengan norma budaya yang telah ditetapkan, sama ada fizikal, jantina, budaya atau penyakit. So how do we look at stigma in epilepsy? Okay. So let's start with what society thinks about people with epilepsy. Let's say if you don't attend this talk, you don't really know what is epilepsy. You heard what people talk about epilepsy and you think, okay, all epilepsy patients, they have low IQ, they have poor energy, which is not true, yeah? But maybe that's how you've learned, or maybe that's how you found out from your friends or your own society. And what society decides is that people with epilepsy are slow at work because they have low IQ, poor energy. So kita dah label them as slow at work, will not succeed, has limited potentials, incapable of carrying large responsibilities. And as a consequences, they don't get accepted in certain workplace when they fully qualified for the job. They are being denied a job, not able to hold a position, important positions such as being a leader in a team, manager, executive, can't get promoted. And most important thing is their potentials and skills were overlooked due to their illness. And because of this, they don't want people to know, and this lead to concealment. So people with epilepsy hide their disease from others, skip their medications, miss doctor's appointment, continue living in fear of being judged by society. They have low self-esteem, become introvert, and they self-isolate. So we started off with labeling because of the standard that we have set to our society, and causing negative stereotype, which is an oversimplified generalization. Just because you think someone has low IQ, they're probably just slow at work, causing division or prejudice and loss of social status, and causing them to be discriminated by concealed stigma and self-isolation. And this labeling causing stereotype, division, us versus them, loss of social status, cause discrimination among patients with epilepsy. So this is what we call the linked stigmatization model for epilepsy. And this concept of stigma is not something new. So even during those olden days, 1754 BC, during the time of King Hammurabi, during the Babylonian King Hammurabi, the concept of seizure has been mentioned. They call it the fallen sickness, and during the Babylonian Hammurabi time, they actually have the Babylonian code of law, okay, of the ancient Mesopotamia. So in their code of law, they tell you, what they've written down, all the laws based on social status, slavery, man versus woman. They were like about 282 laws. And inside those laws, unfortunately, there was already some discrimination for people with certain diseases, and seizures or the falling sickness was one of them. So during those days, seizures were attributed to the hand of sin. Okay, person with epilepsy could not marry, could not testify in court. They were discriminated, like as if they are not a normal human being. Okay, and they, even if you want to purchase a slave, if the slave has a seizure, the purchase contract actually is voided. So even then, there was already some discrimination. In the ancient Chinese writing called Huang Di Neijing, okay, this was written more than 2,000 years ago. They describe epilepsy under two terms, which is Dianji and Xian, or Dianxian. Dian is eventually associated with madness. So they look at people with epilepsy as having a disease of madness. And there's another term that they use, which also equivalent to shamefulness. Having epilepsy is something shameful. And in Malay as well, we also used to call sawan as sawan babi or gila babi, which is such a bad terms to be used. So even the terms that they use to call someone as having epilepsy is already stigmatizing enough. Now, in 1955, in the Hindu Marriage Act in 1955 and also in the Special Marriage Act in 1954, you'll be surprised to see that there were also rules about people with epilepsy. So until December 1999, which is not long ago, India was the only country in the world with an absolute law on epilepsy and marriage. So at that time of marriage, neither party suffers from recurrent attacks of insanity of epilepsy. If you have that, then the marriage is void. So it took a struggle of over 12 years for the Indian Epilepsy Association to have the word epilepsy deleted from this law. So seizure is no longer a condition to claim for divorce. And the discrimination on people with epilepsy is not just in Asian countries, it happens everywhere. In Germany, for example, people with hereditary diseases in 1920s, including epilepsy, were to be barred from having children. They were forced to have sterilization, mandulkan mereka, and extermination of all disabled children. They kill all the disabled children under the age of 3. In practice, all disabled people up to the age of 17 were killed if they have epilepsy. So altogether, about 60,000 persons with epilepsy were sterilized in 1907 to 1964. In Norway, everybody was obligated to disclose his or her epilepsy before marriage. So such discrimination happened towards people with epilepsy. These were in the olden days, okay? But there's another big move, which is called the eugenics move. This is such a big move against human rights, okay? And this is what happened in this move is that they're trying to do ethnic cleansing. They're trying to do disease cleansing. So basically, during this time, they would like to do a racial improvement and planned breeding. So basically, if anyone has bad genes or anyone has disability, essentially they force sterilize these people. They don't want these people to reproduce, or sometimes they just let these people die because they want only selected genes to breed. Okay, and what they did was they want to reduce the rate of sexual reproduction and sterilization of people with less desired or undesired traits, such as people with epilepsy. And surprisingly, there were so many countries that were supportive of this movement. Okay, and this is Hippocrates, and this is our father of medicine. Epilepsy, what Hippocrates said is that epilepsy is no more divine than other disease. Epilepsy should not be treated by magic, but by diet and drugs. Okay. And even during this time, Hippocrates has said that, all this myth about epilepsy is not true. So I've mentioned about all the stigma, all the discrimination that epilepsy patients have gone through over so many years. And we are getting better, definitely. With the emergence of epilepsy societies all around the world, people are more educated now. People are more aware about what is epilepsy. The treatment for epilepsy has advanced so much. We are moving away from all the myths and social discrimination towards epilepsy. Unfortunately, in certain countries and in the third world countries, also in our country, there are people who still look at epilepsy in a very they still have misconceptions towards epilepsy. Now, when we look at people with epilepsy, what do we see? We understand tonight that people with epilepsy have seizures, but we may not be able to see beyond that. If we ask people with epilepsy, what challenges do they go through? A lot of them probably go through a lot of challenges, okay? Challenges living with the disease. Epilepsy itself can cause injury to your body. There's also medication burden, side effects from the medication causing change in your self-image, many hospital appointments and having a lot of sick leaves, problem with their memories and attention because of the seizures, and also taking so many medications. It can cause them to have so low self-esteem, depression, and anxiety. Do you know that epilepsy patients are commonly affected by depression? And also social discrimination. I've mentioned before, due to the stigma that been put on them, they become unemployed, they were denied opportunities, banned from certain private schools, for example, barred from marriage, unable to drive, loss of their independence. And also, you don't forget that they also have family members who look after them. So the burden of social stigma is not just on patients with epilepsy, but also on their carers. For example, challenges that has to be faced by family members or spouse or carers looking after epilepsy patients, and this include emotional, physical, financial challenges, and also social discrimination. Because of stigma and discrimination, we have caused these patients to isolate themselves. And because of that, they don't want to reveal about their disease. I had a patient who, every time when the patient that she wants to have, she was going to have a seizure, she got a warning. She will run into the toilet, have a seizure because she will lose awareness and all that, and then she'll come out because she doesn't want her boss to know. And she doesn't want the boss to know that she has to take sick leaves to attend medical appointments. So sometimes she will miss her hospital appointment. And this causes treatment delay and poor outcome and further disability on this patient. So why you are here tonight is we want to break the stigma. We want to support epilepsy awareness. So do we have society here that you can actually help and join to spread the awareness, like what you're doing tonight, to learn about epilepsy? Yes, we do. And this is when Persatuan Epilepsi Malaysia comes in. You see, I like this saying, do not fear the lack of knowledge, because fear false knowledge. I sort of use this what do you call that? What's the word? I'm losing my word. Okay, anyway, I always remember this, because when we fear of when we fear of something, if we don't learn about it, then we will continually ikut ajaran sesat, so you will, because of your lack of knowledge, you will misunderstood certain things. Okay, so do not fear the lack of knowledge, fear false knowledge. So why you are here today is to learn about epilepsy facts. What you have learned today is that epilepsy is not a contagious disease. Okay, it's not penyakit berjangkit. Not all epilepsy is due to hereditary, meaning doesn't mean that you have epilepsy, you will always pass it to your offspring or to your babies. So only certain type of epilepsy is genetic based. Most epilepsy is not due to genetic. So it doesn't mean that someone have epilepsy, you're afraid to get married to that person because you're worried that your children's going to get epilepsy. That's not true. Okay, so bukan semua epilepsy disebabkan penyakit keturunan. And not all epilepsy is due to severe injury to the brain. You have learned today what are the causes of epilepsy. Pesakit epilepsy can get married. So patient with epilepsy, just like you and me, they can get married, they can be pregnant, they can have children, and they can have a happy family. And epilepsy is not to do with mental illness, bukan gangguan mental atau emosi. And pesakit epilepsy can be active secara fizikal dan bersukan. They can be active physically and they can do a lot of sports activities. Okay. Now, majority of patients with epilepsy can achieve higher education, employ, and succeed in their job. There are very limited number of jobs that patients with epilepsy can't do. For example, if you have epilepsy, you can't be a pilot. You can't be the railway staff. Okay, because you're concerned if patient have an attack and then fall on the railway and all those things, and also operating heavy machinery, handle firearms. Okay, so they cannot be police or armed forces. They cannot drive heavy machinery. They cannot do certain sports such as professional boxing or become a race car driver. So there's a lot of leisure activities that epilepsy patients can do. However, there's only limited number of activities high risk to these patients, for example, boxing, mountain climbing, and parachuting, unless they have no seizures or not needing any medication for 5 years. And do you know whose painting is this? I can't actually look at the chat box, but this is the Starry Night, right? Yes, Van Gogh, Jumana, that's right. And do you know that apparently Van Gogh had epilepsy? He also has other disease as well, but look at him, he's such a talented artist, but he had epilepsy. And there are many other people with epilepsy who have done so well in their life. For example, the famous musician Neil Young and famous poet Edgar Allan Poe, the president of United States of America, Theodore Roosevelt, Charles Dickens, famous author of children books, and also Florence Griffith. She's a very successful Olympic runner. Okay, well, I think she died of seizure attacks, but she's done so well even though she was an epilepsy patient. And one of her famous quotes was that, when anyone tells me I can't do anything, I'm just not listening anymore. And I hope that this can always motivate our epilepsy patients to achieve their dreams, and also for us to support them. So what can you do to help these patients? We want to break the stigma, okay? Forget about all the myths, misconceptions on epilepsy. Learn about epilepsy. Don't fear epilepsy or the disease just because you don't know what epilepsy is all about. And that's why you're here today. Get your facts right. Do not discriminate people with epilepsy or isolate them. Understand their challenges and try to help them. Know what to do when someone has a seizure attack at your workplace or school. Learn about seizure first aid. And when you fear something, learn as much about it as you can, because knowledge conquers fear. And if you're not sure, and if you want to know more about epilepsy, you can always join our Persatuan Epilepsi Malaysia forums and events and activities. You can meet with people with epilepsy, carers, people who work in the field of epilepsy, such as researchers, scientists, medical doctors. They are all members of Epilepsy Society. So if you join us, then you can interact with them and learn more about epilepsy. When I become a neurologist, when I see my patients in clinic, they're very different. The situation is very different. When you are actually out there interacting with this patient outside the clinic, the things that you talk about, the things that you know about these people is a lot more than what you could get in a 20-minute consultation in a clinic. So when you meet up, spend your time, join activities with them, the experience is a lot more than what you can get from seeing them in a hospital. And if you want to know more about epilepsy, if tonight's information is not enough, then you can always get your information from our Persatuan Epilepsi Malaysia information platform. We have Facebook, we have Instagram, we have our website, which is Epilepsy Society Malaysia Google page. And if you're not sure if there's anything that you want to contribute, you can always email us at epilepsymalaysia@gmail.com. I'm actually towards the end of my slides. I just want to say here is that the history of epilepsy can be summarized as 4,000 years of ignorance, superstition, and stigma, followed by 100 years of knowledge, superstition, and stigma. Thank you.
Thank you, Dr. Sherni Wazir Ahmad, for your wonderful and informative talk. Hopefully, this talk will be beneficial to all of the participants. Now, I would like to continue with the Q&A session. So we welcome any queries you may have. Actually, we already have a few questions from the YouTube and also the WebEx. So we'll start
If
with
you
the
if you
first.
have time to if we have time, I still have the video of the first aid that I can show if you want to see, because when you look at video you understand better, right, in terms of seizure first aid, because that's quite important. Yeah.
Okay. Can we proceed with the Q&A session first, Doctor?
Sure.
Okay. So first question from Lukman. Doctor, what causes the abnormal development on the baby's brain? Does it relate with the mother's?
No, not necessarily. There are many different types of abnormal development of the brain. One I've only shown you one of them, which is focal cortical dysplasia, and there's also the abnormal folding of the brain and all that. Sometimes it's to do with the pregnancy, the medication that the mothers take, or the illness that the mother get during the period of pregnancy. So if the mother is unwell or infected by certain viruses or sickness, then it may affect the development of the baby. Some occur nothing to do with the mother. It's just the way the delivery happens, the labor. Some may have difficult labor, causing restricted oxygen going to the baby that can affect the baby's brain. Some just happen due to genetic factor, and this genetic factor doesn't necessarily have to come from the parents. Sometimes it can also occur sporadic, meaning after you've born and something, some some problem with the genes, and then causing for developmental problem of the brain afterwards. So this is what we call postnatal. So not always to do with the mother, many factors. Yeah.
Okay. Next question. Can kidney failure lead to seizure?
Certainly it can. So what we call metabolic causes. So liver failure, kidney failure can all cause someone to have seizures. For example, if someone has failing of the kidney, if they have high salt intake, high salt level in the body or low salt level in the body, that can also cause seizure. Yes. But doesn't necessarily cause epilepsy, just seizure. Meaning you treat the kidney goes back to normal, then your risk of getting another seizure won't be there anymore. So you don't call that person as having epilepsy.
The next question from Wan Alia. Can seizure cause the patient to bite their tongue?
Not all seizures, but certain type of seizures can. So generalized seizures or motor seizures can cause them to have tongue biting, yes, but not all type of seizures.
Next question from Ahmad Afam. Doctor, do all seizure medications cause a person to easily forget their memory and get hot-tempered?
Okay, that's a good question. Not all, but there are some medications. So this memory issues always come up, in any talk that we do. When epilepsy patients have memory issues, there are two things that we have, at least two things that we have to look into. Number one is how frequent is the seizure? Where is the seizure activity? For example, if the seizure activities occur quite frequently in the area of the brain that actually control your memories, such as the temporal lobe, then that can also affect your memory. So not treating the seizure can actually worsen the memory. So in this case, you have to give medication or increase the medication. But in some cases, having a polypharmacy, so having many types of medications, sometimes can also cause a burden to your memory as well, slow in thinking, feeling tired. Mood swings is also one of the side effects of some types of medication. For example, if you take levetiracetam, one of the levetiracetam and also perampanel, for example, these two medications can also cause mood swings in some people, but not all medications cause that.
Okay, next, Rosdianti asks, which treatment is the best for epilepsy?
I think that's a difficult question to answer because it's not about which treatment is the best. Number one is to find out, what type of epilepsy you have. And all the drugs are good drugs, and how we choose which medication. So let's talk about medications, yeah. So how we choose our medication, they will say, doctor, is this medication better than the other one? It's not about that. It's about choosing the right drug for the right seizure types, choosing the right drugs for the right seizure epilepsy syndrome. Also, you have to look at your patient individually. So, you know, certain drugs is not suitable for childbearing age ladies. Certain drugs are not suitable for breastfeeding mother or pregnant ladies. So you have to tailor it individually to your patient. So that's medication. In terms of who can go for surgery, who goes for neuromodulation and all those things, also depends on what type of epilepsy, what is there a brain lesion that can be operated on, and how frequent is the seizure. If you can't go for surgery, and if surgery fails and you're not a candidate for surgery, for example, but you still get about 30% of patients have refractory seizures in which medication alone cannot help to control the seizures. So these are the ones that we actually tailored for surgery or other type of treatment. And for example, this neuromodulation can be used if the patient is not suitable for surgery. So at the end of the day, it's not which one is best. You have to look at your patient's case by case.
Then next, Rosmadiana Rustan asks, if I have an epilepsy, can I get the car license?
If you have epilepsy, can you get car license? Okay, depends if you declare you have epilepsy or not. In UK, you know, for example, in UK that I know that you have to declare, and if you don't declare, then you can't get a car license lah. Over here, it says in the JPJ that if you have illnesses that can harm yourself or others, then you shouldn't be driving. And they have mentioned about seizure. So if you actually declare, then you are not supposed to be driving. In Malaysia, I think one of the guidelines, I can't remember now, it says there that you need to be seizure free for 2 years before you can drive. However, we feel that 2 years is quite a long time. In UK, for example, you need to be seizure free for 1 year, then you can drive. So in the meantime, the Epilepsy Council currently is trying to work on this, trying to look back into the rules and regulation for epilepsy patients in Malaysia with regards to licensing and driving.
Next, Umesh asks, does strobe light really trigger an individual with an epilepsy? If yes, how so?
Okay, so there's certain frequencies, okay, and there's certain type of epilepsy. So usually people with epilepsy who are photosensitive, so photosensitive epilepsies, certain frequency of the strobing lights can actually trigger their seizure. I think there were a few cases, you know, in cinemas. They went and watched movies, and then suddenly there's this strobing light, and patients start having seizures. I think the Incredibles 2 is one of them that actually have this strobing light, and there's a big warning there that says people with epilepsy shouldn't be watching. So not all patients with epilepsy get triggered by strobing light, only a certain type of epilepsy only. And if this were to occur, let's say you're watching something in a cinema, closing your eyes, both eyes, somehow doesn't help. So if suddenly, you know, you're faced with strobing lights and you know it's going to trigger your seizure, closing both eyes somehow not going to help. You still can have your seizure because somehow you can still see the strobing light. But the trick is actually to close one eye. So if you see strobing light, close one eye, and that can help to reduce the chance of having a seizure.
Rosmadiana asks, how can we know that we have epilepsy? Is there any clearly symptoms?
How do we know that we have epilepsy? Is there any clearly symptoms? I guess from the talk today, all the signs and symptoms that I have mentioned today in the talk. That's, I guess, what epilepsy is all about.
So next, Hidayah asks, can epilepsy be declared as people with disability and can they request OKU card from JKM?
Okay, that's also a good question. So in Malaysia, to be declared as OKU, you have to have, I think, 4 deficit, right? One is physical, one is physical, pendengaran, pertuturan, and vision, if I'm not mistaken, and also mental. So as you know, epilepsy sometimes doesn't fit with any of this category. So it's very hard to declare them as having OKU. This is one of discrimination, I suppose, that we talk about, because it's a hidden disability. However, we try very hard to obtain OKU card for our patients. If we feel that under the OKU application, there's a section there where it says gangguan fungsi kognitif dan gangguan fungsi sosial. So in there, we will put as ketara, because if they're having a lot of seizures, they can't go to work, they can't socialize and all that, I guess that's quite relevant. That's not lying, that's actually telling exactly what our patient's going through. And honestly, a lot of time JKM actually approves them to have OKU cut.
Wendy asks, why different neurologists with EEG report differently?
Sorry, can you repeat that question again?
Why different neurologists with EEG report differently?
Not too sure. It shouldn't. Maybe the way the report is being presented can differ, but at the end of the day, the conclusion should be the same.
Next, Siti Nur Aisyah asks, if the person is attacked with epilepsy when they are sitting, should we lay them down on their side too?
Depends if they're just having a behavioral arrest where they just, sit there quietly, appear confused, just rocking their body, fumbling around, then no, you just make sure that the patient is safe. If she's sitting down, let her sit. If she's going to stand up, some of the patient's family members just follow them around, just making sure they won't harm themselves as they walk around. At the end of the day, you don't restrain them. Right? That's important. Only if they fall to the ground, they're going to have the big motor seizures. You then lie them on the side and protect their head. Yeah.
Umesh asks, has modern medicine fully cured a patient with epilepsy?
Yeah, unfortunately, when we say cure epilepsy, so patient is considered cured from having epilepsy if they don't have any seizures for the 10 years without medication. Have we found any patients like that? Okay, so there are a type of epilepsies that cured or resolve after a certain age. For example, if you have childhood absence epilepsy, which happens in childhood, and then as they grow up, they become teenagers, you are cured from epilepsy. Now, there are also conditions such as, abnormal brain structure, such as your mesial temporal sclerosis that I've shown earlier, in which when you remove that area, patients become seizure free. And at some point they can, not everyone, but some of them can come off the medication. So I guess you can say cure. But a lot of time, a patient with epilepsy needs to be controlled with medications. So there are certain type of epilepsies that can be cured, but there are certain type of epilepsies that patient may need long-term medications. There's another type of epilepsy which is a generalized epilepsy, such as the juvenile myoclonic, idiopathic absence epilepsy and all that. So this generalized epilepsy, they need to be on medication lifelong, because if they stop their medications, the chance of them getting seizure is high. So there are certain type of epilepsy where the patient needs to go on medication lifelong.
Jumana asks, What causes the foaming or drooling during the epilepsy?
Foaming or drooling. A lot of time is to do with the muscle in the in your throat. So what we call the bulbar in this region. Okay, so during this time you lose tone or you become stiffened. The tone becomes stiffened. So I suppose that's why you start drooling and foaming and all that. Yeah.
Hidayah asks, how epilepsy affect our brain memory, our feeling and physiology, especially for temporal lobe epilepsy?
Okay, good question. How epilepsy affect our brain memory, our feeling and physiology. Okay, in temporal epilepsy is one of the commonest type of focal epilepsy, and a lot of things happen in your temporal lobe. So, memory is one of them. Controlling your feelings is also temporal lobe does that. So the center for controlling your feelings, your fear, excitement, and all that comes from temporal lobe as well, and your memory also comes from temporal lobe. So if there is any abnormal lesions or tumor or abnormal electrical activity that interrupts the network of the neurons in the temporal lobe, then can actually affect your memory and your feelings. So that's why patients with temporal lobe epilepsy, sometimes before they get their other bigger seizures, some of them may have abnormal feelings, like some of them feel scared for no reason, impending doom. Some of them feel like they're falling off a roller coaster, so epigastric sensation. Some feel sad for no reason. So because of the abnormal electrical activities in these centers. Yeah.
Next, maybe one more last question from Jumana. If a person usually has a light or brief epilepsy episodes, can they still qualify for things epilepsy patients usually can't have? For example, being a pilot.
Pilot, they're very strict to get your pilot license. If you have epilepsy, no, the answer is you can't be a pilot. Yeah. So for once you have the diagnosis of epilepsy, there are certain things that's definite no lah, like what I've listed down earlier.
So thank you so much, Doctor, for answering all the questions. I think that's all for the Q&A session. Sincerely, thank you for all the questions given. Now, we may continue with a video sharing from Doctor so we can understand today's topic better. Let me share your screen.
Okay, so I'll try to share. Let me see. A very short video actually. Okay.
If you suspect someone is having a seizure, it's important to protect them from harming themselves during the fit. Clear away any potential dangerous objects like hot drinks or sharp objects. Don't restrain or move them. Make a note of the time when the seizure started and how long it lasts. Protect their head by placing something soft underneath or around it, like a towel, and loosen any clothing around their neck. Once the seizure has stopped, open their airway and check their breathing. If they're breathing, put them into the recovery position. If they stop breathing at any point, prepare to treat someone who is unresponsive and not breathing, monitoring their level of response. Call 999 or 112 for emergency help if it's the person's first seizure, the cause is unknown, they're having repeated seizures, the seizure lasts more than 5 minutes, they are unresponsive for more than 10 minutes, or they've sustained an injury. So remember, protect, but don't restrain them. Call 999 or 112. And that's how you help someone who's having a seizure.
Uh, okay. So for us, I think it's 911. I think it's 911, isn't it, for our emergency call? Sorry, it's very late at night now. And if you're not sure, always call an ambulance. I suppose that's the general rule. And if the seizure lasts for more than 5 minutes, call the ambulance. It's quite normal for someone who's just had a seizure to feel very tired. Sometimes they even want to sleep, and they can sleep for hours before they're back to their normal self. Some people may feel very tired throughout the whole week after a seizure. So if you see them sleeping after the seizure, it's quite normal, but try to wake them up. If you're not sure what to do, just bring them to the hospital or call ambulance.
Well, thank you, Doctor, for the wonderful and informative video that you shared for us. Hopefully, everyone get more knowledge and understanding about epilepsy from the sharing. Now, let's move on to our next tentative, which is quizzes session. In this session, the participant will enter the quizzes application by entering the code that will be shown on your screen. All the questions in this quiz are based on our talk session before this. With that, I will pass the floor to Alia Patiha binti Saidon to host the quizzes session.
Assalamualaikum and hello everyone. I'm Alia Fatihah and I will be the person in charge for this quiz session. I hope all the participants will join these quizzes and the top 3 winners will receive prizes. You guys need to put your real name so everyone can enter the code 989106. We will start our quiz session in a few more minutes while waiting for the participants to enter the quizzes. Reminder for all the lucky winners, please screenshot your screen as a proof to claim the prizes later. I hope all the participants can join our quizzes so you will get the prizes if you win. Is there anyone who wants to join our quiz? If not, we will start our quiz now. Okay, we start, okay? Okay, the first question. What is seizure? Which of the following can cause of epilepsy? Okay, Luqman at the first place. Okay, next question. Epilepsy is when someone has a seizure. True or false? Which of the following are not the signs of seizure? Okay, for now, Luqman, Preeti, and Farahin is the top. Which of the following are the types of epilepsy? Local epilepsy or generalized epilepsy? General, how many different types of epilepsy are there? Either 3, 5. Okay, Farahin is the top one right now. Now let raise epilepsy. True or false? You see if you want someone who has epilepsy, either see neurologist or seek help from specialists. Okay, Farahin, Iman, and Wei still the top 3. Goals in epilepsy. Question number 10. Epilepsy linked with various misconception of blindness. Which of these is true about epilepsy? Cause misunderstanding, fear, secrecy, stigmatization, and social isolation. True or false? On the code of Hammurabi in 754 BC, which statement is false? What do you mean to assist someone suffering from epilepsy? What kind of job is appropriate for someone who has epilepsy? Librarian, pilot, relative staff, professional nursing. sports. However, some activities are considered high risk and should not be undertaken by someone with epilepsy. What exactly is it? Badminton, boxing, bowling, or chess? What are some causes for epilepsy? Prevent traumatic brain injuries, wash your hands and prevent septic, stay healthy during your pregnancy, and last one, all of the above. Okay, this is the last question. Epilepsy and seizure training programs for professionals including school staff, mental health professionals, first responders and law enforcement, all of them. Okay, congratulations to all the winners. You guys can claim your prizes by filling out the Google form that provided in the chat box. Thank you to all of you for joining our crazy session tonight.
Congratulations to those who won the quiz session. To the winners, don't forget to fill in the Google form link that has been provided in the chat box to claim your prizes. Ladies and gentlemen, Let us continue our program with the lucky draw session. All registered participants who join our lucky draw will get a chance of winning cash prizes. With that, I will pass this session to Nur Afika Izati binti Kadeni to host the lucky draw session.
Hi everyone. So finally we are in the lucky draw session, and for this session, I will call the lucky name for 3 times only, and please respond as soon as possible. And if there's no response, then I will go to the next lucky name. Okay. Reminder for all the lucky draw winners, please print out your screen as proof to claim the prizes later. Okay. Hazim, can you share the screen? Okay, finally Hazim is here. So let's spin. Who's the lucky one? Okay, Almas Zakia, are you there? Almas Zakia, 1. Almas Zakia, 2. Please respond. Almas Zakia. Oh, she's on YouTube. All right. Please screenshot the screen. And let's move to the next lucky name. Desmond Non Lidong. Are you there? Desmond? Desmond 2? Desmond 3? Okay, sorry. Let's move to the next lucky name. Dania. Dania, are you there? Please respond at the chat box. Dania 1. Dania 2.
Yes, doctor.
Okay, Dania, are you there? Okay.
Yes, I'm here.
Okay, let's move to the next lucky winner. So this is the third winner. Wow. Lucky. Okay, let's go to the next winner. Okay, this is the second last winner for this session. Let's see. Group 3. Are you there? Please respond if you're here. Group 3, 1.
Yes, she's
Group
here.
3, 2. Alright. So,
Yes,
you can screenshot the screen here. Okay. Okay, let's move to the next lucky name. There are 5 prizes for quiz. For quiz, only 3 winners. So the last winners for lucky draw is Nurul Akila. Akila binti Muhammad Nazri, are you there? If you are here, please respond. If you are not, we will move to the next winner. Nurul Akila 1. Nurul Akila 2. Nurul Akila 3. So let's move to the next winner. Because Nurul Akila is not here. Okay, who is the last winner? Iman Kasrina, are you there? Please respond. Iman Kasrina 1. Iman Kasrina 2. Please respond. Iman Kasrina 3. Okay, Iman Kasrina is not here. So we will move to the next lucky winner. Sorry, Iman. Okay, Nur Atika Balkis, are you here? Nur Atika Balkis, are you here? Nur Atika Balkis, please respond. Okay, Akila Nazri is on the YouTube, so sorry. As no Atika Balkis also no respond. So we will choose Akila Nazri. Okay, thank you. That's all for the quizzing. For the lucky draw session. Bye. Thank you. Don't forget to fill in the Google form.
Hi, excuse me. Excuse me. Can you hear me?
Yes, we can hear you.
Hi. So me and Gurpreet, we couldn't screenshot because it was quite fast and the line was very bad. So how do we put in the screenshot? I mean, when we fill up the Google form, how do we put in our name at the screenshot part for the lucky draw?
Oh, it means that you cannot screenshot the screen and apa tu nak kata
Yeah, correct. Because
tak boleh masukkan dekat dalam ni lah, dekat dalam Google Form tu.
yeah.
It's okay. Kat sini awak dah ada bukti yang awak ada kat sini.
Oh, okay. So
Okay.
just me and Gurpreet, we just will fill in the Google form, just put in our name lah.
Yes.
Okay. Thank you so much, Nur Amira. Me and Gurpreet, we just will.
Okay, thank you. Don't worry, we have all the winners, all the list of the winners. Okay. Congratulations to those who won the lucky draw just now. To all the winners, don't forget to fill in the Google form link that has been provided in the chat box to claim your prizes. So it's been a wonderful day. I hope all the participants enjoy every session that we had gone through today. Hopefully, all the participants can use all the knowledge that you acquired today to a good use in the future. For that, before we end our charity program for today, we would like to invite everyone to turn on their webcam and join us for the photography session to commemorate this session with a few group shots of this eventful session. Come on, guys, let's go open your camera. Don't shy, let's go open your camera if you're not shy. Come on, don't be shy, it's okay. If everyone already opened the camera, we may now proceed on taking the picture. Yeah. Ready? Those who open the camera may pose. Okay, ready? 1, 2, 3. Okay, get you beloved. Okay, ready? 1, 2, 3. All right. Okay, thank you everyone for joining in with the photography session. Before, thank you for all your cooperation. For the participants' information, the Psychology Interactive Club Psychic will be organizing a charity program that focuses on educating psychology students and the public about epilepsy. The organizers of the program will open a collection of donations, and these donations will be donated to the Malaysian Epilepsy Association. Any contribution value can be channeled via check, bank draft, cash to the bank, and the name shown on the screen and at the chat box. For those who have donated, don't forget to fill out the Google form and include the donation receipts. And now the ceremony has come to its end. Once again, thank you everyone for gracing our ceremony with your presence. We truly appreciate it. We look forward to seeing you at the next psychic program. On behalf of the organizing committees, I would like to apologize if we have done any mistakes throughout the event. Dear participants, if you want to join to show your support for epilepsy, you can buy a t-shirt from the Malaysian Society of Epilepsy. All the details have been shown on the screen. Participant who is interested in buying that t-shirt, you can screenshot all the info given. Thank you. Dear participants, don't forget to fill out the attendance form by scanning the QR code and click on the Google form link. It is important for merit and e-certificate purposes. We have provided you with the link in the chat box or the comment section. And now, I end my duty as the moderator of the program for today's event with Wabillahi Taufiq wal Hidayah. Wassalamualaikum warahmatullahi wabarakatuh. We look forward to seeing you at the next psychic program. Thank you, everyone. For those who have scanned the QR code and also fill in the Google form link given on the comment section, you may leave the WebEx. Thank you, everyone. Have a great day. Thank you for those who joined. Have a great day, everyone. Those who haven't filled in the Google form link and also the QR code, you guys may do it now, as it is very important for your e-certificate and also merit. Thank you everyone for joining and participating. Have a great day. Have a great night.